The diabetes-Candida connection. Candida infections can be quite detrimental to your health, and if left untreated, it may even cause diabetes. The naturally present fungus is supposed to stay in a balanced environment brought about by a healthy immune system. Unfortunately, there are things we consume which may end up leading to an imbalance in our inner environment, hence lead to an overgrowth of the fungus. This imbalance may be caused by antibiotic use, a poor diet filled with carbohydrates and sugar, or pregnancy and other conditions. This overgrowth of the fungus leads to body dysfunctions through a group of protease enzymes which are known as secreted aspartyl proteases, in simpler terms, SAPs. SAPs destroy receptors which are found on our cell walls. This destruction leads to an increase in the sugar levels found in the blood. SAPs also destroy white blood cell attachment zones, which are what ideally enable the cells to exit the bloodstream and access infected tissues. The receptors bind insulin, which is naturally produced in the pancreas. The result of this is insufficient amounts of insulin and unregulated amounts of blood sugar, consequently leading to diabetes development. Researchers tell us that protease enzymes are dangerous on certain levels and can also suppress the immune system and cause hypertension as well. Poor immunity and hypertension are known symptoms of infections brought about by the fungal outgrowth. Sugar and fat. To explain the whole relationship in simpler terms, we need to talk about sugar and fat. Candida is known to flourish in sugar. When there is sugar present in the blood, it distracts body functions and brings about symptoms such as fatigue. For the body to function properly, sugar must enter the cells. As explained earlier, SAPs destroy these cell walls and hence sugar cannot enter. This sends out a message to the pancreas, which then begins working on insulin production. The more sugar cannot enter your cells, the more pressure the pancreas has to produce insulin. At some point, the pancreas gives in and cannot produce insulin anymore, leading to what is known as type 1 diabetes. When people develop diabetes, they need to be careful with what they consume and not replace their need for sugar with fat. This is because the fungus is so agile and versatile that when no sugar is present, it comfortably moves on to fat. When we consume too much fat, our livers, which are responsible for processing it, cannot handle the workload. This means that your body now has excess fat circulating, creating more deposits for the fungus. This way, even as a diabetes patient who does not consume sugar, you will still have a perfect breeding ground for the Candida. Candida control. So, what can be done to prevent all these happenings? For starters, you need to take better care of your body by consuming foods that are well balanced. Sugar and fatty foods are never encouraged. Secondly, get treatment. Do not let Candida thrive in your body. Ensure that you get proper diagnosis and treat it accordingly.